direction. I always use security as the driver for application rationalization. I remember when I came in, we had like 3 applications that required dongles in the server. And I just sort of shook my head like, how old is that? I don't even remember the last time we had that, but in healthcare, they exist. And we're looking at 800 applications and maybe even 50% more or whatever of instances of those applications, because you have the same application with multiple instances. It's the attack vector is too large. The surface is too large. When are we in healthcare going to see that and just crunch that down to, I don't know, to half the number of apps? I almost think every health system should have as a goal to get to half the number of apps in the next 5 years.
Yeah. I mean, in the spirit of everything is connected to everything else, security is also connected to everything. So if you have antiquated infrastructure, if you have a data center with older servers, if you have endpoints that have kind of aged out and you're running older operating systems on those things, the simpler you can make the environment, like you talk about application rationalizations, fewer applications. And we both know, having worked at big health systems, sometimes you have 5 applications that do almost exactly the same thing. They're just the personal preference of somebody in different departments. And that requires you getting together and sort of clunking their heads together and say, let's pick one and kill off 4. It's less maintenance. It's fewer analysts that we need to be able to manage those applications. And when we get down to 1, it's much easier to secure instead of 5. So you're right. It's not usually thought of as a security thing, though, right? This is where we get into sort of conversations about infrastructure upgrades and endpoint upgrades and printer upgrades and all those kinds of things. Security is a huge part of that. Simpler is easier to secure.